Narcissistic personality disorder is a pursuit pattern of grandiosity that is in fantasy or behavior, need for admiration, and lack of empathy. History. The term narcissistic derives from the Greek legend of Narcissus. He is known as the youth who fell in love with his own reflection in a pond. Prevalence. Prevalence estimate for narcissistic personality disorder based on DSM-4 definition ranges from 0 to 6.2% in community samples. Gender-related diagnostic issues of those diagnosed with narcissistic personality disorder, 50 to 75% are male. Diagnostic criteria, as indicated by five or more of the following, includes has a grandiose sense of self-importance. Example, exaggerates achievements and talent, expect to be recognized as superior without commensurate achievements, is preoccupied with fantasy of unlimited success, power, brilliance, beauty, or ideal love, believes that he or she is a special and unique and can only be understood by or should associate with other special or high status people or institutions, require excessive admiration, has a sense of entitlement that is unreasonable expectation of specially favorable treatment or automatic compliance with his or her expectations, is interpersonally exploitative that is takes advantage of others to achieve his or her own ends, lack empathy that is unwilling to recognize or identify with the feelings and the needs of others, is often envious of others or believes that others are envious of him or her, shows arrogant, haughty behaviors or attitudes. Treatment management. Treatment options are limited. Only psychotherapy, medication, self-help resources, and long-term insight-oriented therapies are available. Principle of effective therapies include set realistic goals, attend to treat frame, attend to relationship and self-esteem, build alliance, monitor counter-transference. Prognosis. Prognosis is limited and based mainly on individuals' ability to recognize their underlying inferiority and decrease of self-worth. With insight and long-term therapy, the symptoms can be reduced in both number and intensity. There is a chance of improving behavior and thoughts that NPD patients have through therapy and medications. So, sorry.
morning, everyone. Today I'm going to present about a borderline personality disorder, a comprehensive view. I'm Dr. Saiba Kamra and my moderator is Dr. Arpita Negi ma'am. Okay. So basically, what is a personality disorder? A personality disorder, according to DSM-5, the definition of a personality disorder, it is an enduring pattern of inner experience or behavior that deviates markedly from the norms and expectations of an individual's culture, is pervasive and inflexible, has an onset in adolescence or early adulthood, is stable over time, and leads to distress or impairment. So the personality disorders are further classified into different clusters. So cluster A includes paranoid personality disorder, schizoid personality disorder, schizotypical personality disorder. Cluster B includes antisocial, histrionic, narcissistic, and borderline personality disorder. Cluster C includes avoidant personality disorder, obsessive compulsive personality disorder, and dependent personality disorder. So, what is a borderline personality disorder? A borderline personality disorder is a pattern of instability in interpersonal relationships, self-image, and affect and marked impulsivity. So, according to the DSM-5 diagnostic criteria, uh, a person with to diagnose a person with a borderline personality disorder, he should fulfill at least 5 of the 9 that I am going to tell. First is frantic effort to avoid real or imagined abandonment. So, for example, a person is waiting for another person to meet, and that person is having a borderline personality disorder. So, that person would actually get a panic or furry, even if the other person that is about to come and meet would be late by few minutes, or the other person cancel an appointment. There is identity disturbances, markedly and persistently unstable self-image or sense of self. Third, recurrent suicidal behavior, gestures, or threat or self-mutilating behavior. Fourth, chronic feeling of emptiness. Fifth, transient stress-related paranoid ideation or severe dissociative symptoms. Sixth, inappropriate intense anger or difficulty in controlling anger. So the patient would evolve into in excessive sarcasm, or sometimes the person is unable to control the anger. Sixth, a pattern of unstable, intense interpersonal relationships characterized by alternating between extremes of idealization or devaluation. So, for example, a person with a borderline personality disorder is in a relationship. That person would go from idolizing the person in very first meeting, the other person in very first meeting, sharing the intimate of their details, and then suddenly there would be a devaluation of the partner. They would go from idolization to devaluation of the person. Eighth, impulsivity in at least 2 areas of potentially that are potentially self-damaging, like binge eating, like recklessly driving, engaging in unsafe sexual activity, or drinking, or substance abuse. Ninth, affective instability due to marked reactivity of mood. So the effects could be they may have a pattern of undermining themselves just at the moment the goal is about to achieve. For example, just dropping out of the college when they're about to graduate, or just when they're about to know that that relationship could last long, they'll just break off from that relationship. They might have psychotic like symptoms like hallucination, body image distortion. They feel more secure with with transitional objects like a pet or a soft toy than being with a real person. Then there may be instances of premature death due to suicide, or maybe due to reckless driving or engaging in certain activities. They co-occur with a depressive or substance abuse. So, what are the causes and risk factor? According to the genetics, it is 5 times more common in among the first degree biological relatives. It is more common amongst women, and it is more common in the people who have experienced childhood abuse, sexual abuse, or some sort of emotional neglect. What are the common symptoms? There is fear of abandonment, there is unstable or intense relationship, chronic feeling of emptiness, intense anger or difficulty controlling it, impulsive behavior like substance abuse, gambling, binge eating, driving recklessly, recurrent suicidal behavior, gestures or threat or self-mutilating behaviors. What are the associated comorbidities? Substance abuse, eating disorder, post-traumatic stress disorder, anxiety disorder, attention deficit hyperactivity disorder, depressive and bipolar disorder. What are the treatment options available? So the treatment options can be, we can sort some sort of psychotherapy, and dialectical behavioral therapy is one of them. So it aims at acceptance and behavior, improve emotional regulation, mindful awareness, distress tolerance, and it manages the self harm, the person from self harm. And it could also there could be supportive therapy that would be in form of group or family therapy, or some sort of medication can also be tried. So these are the resources that I have taken help from. Thank you.
I think I missed your presentation. No, very good slides. Excellent. So, almost good presentation is when it ends, so you always you would want कि अच्छा ये और होता. And then presentation that takes you off is कि अरे कितना time बचा है. People start to do that. So that sense is a very I think internship you're doing this, so you have to build upon it, and then you can be a very good speaker. I missed your presentation, so that it's sort of brief overview. Basically, we more accustomed to apply this model and ever. But I've seen there, even once you segregate it, you start to think about it. One vegetation cut. That should be of the practice. It's a pattern, a flexible pattern. So pattern needs to be established by longitudinal history and chronic repeated events. So if some young girl would be admitted with a single agitation cut, one suicide attempt and one relationship issue, so then again you have to see whether normal, abnormal, that differentiation needs to come. So clinical jurisdiction is very, very important. Merely counting symptoms and putting into one frame will can land you up in errors also. At the same time, traits are very common. So traits are pervasively common in So many of us might be having narcissistic traits, or borderline traits, or histrionic traits. That is very. That is, so most of us may have those. Many of the patients with disorders, very, and this is a very difficult area. Not at the same time easy to have a specific interest in personality disorders. So interest, you can always go into him and discuss these things in detail. Maybe you are noticing narcissistic people more being successful. Many other people are also successful with them. If they're narcissistic, make them more visible or noticeable. When you will for photograph, plus we'll get the original certificates tomorrow. All the best. तो स्पोर्ट्स एंड सेक्रेटरी भी बोला था ना, प्रेजेंट किया ना, कोई बात नहीं, एक और करते हैं। Okay? Thank you.